Welcome. This is a general review of the information from your preoperative appointment. It is important to follow any specific instructions given to you by your bariatric provider. Please note, if you're looking for only information regarding a specific part of the pre-op appointment, you may skip ahead in this presentation to view that information you're looking for. Let's dive right in. The pre-op diet will start 2 weeks before your surgery. It consists of 4 high-protein meal replacement shakes or 3 high-protein meal replacement shakes plus 1 frozen meal that is less than 320 calories. These meals and/or shakes should be spread throughout your day. We recommend using Bariatric Advantage Meal Replacement Protein Shake Mix unless you're unable to tolerate this. This is a powder shake mix that you will mix with 8 full ounces of skim milk, lactose-free milk, unsweetened non-dairy milk, or water, depending on your surgeon's preference. There are a couple of additional items that you can have. This includes plain vegetable beef or chicken broth, straight broth with nothing in it. You can have up to 2 cups of this each day, or sugar-free, low-calorie Jell-O with no added topping or fruits, up to 1 cup each day. We typically recommend not having the additional broth and sugar-free Jell-O if you're able to go without it. However, if you need something extra in your day, you may add these in. Remember not to have anything to eat or drink that is not listed on the pre-op diet plan, otherwise you do risk your surgery being canceled. It is important to stay hydrated during the shake diet. You can have any beverage with 0 calories. We do recommend getting at least 64 ounces of water each day in addition to your shake diet. Avoid caffeine during this time. Make sure you're practicing sipping your water at this time so you can learn how long it will take for you to get in 20 ounces, 40 ounces, etc. You'll need to be sipping after surgery, or the extra air and fluid intake may be too much for your healing, smaller stomach, and this can be painful. Many patients do struggle with dehydration after surgery because they don't realize how much they need to sip every few minutes. Keep your water bottle with you. You will need to take bariatric multivitamins lifelong after surgery. We recommend the vitamin mineral protocol listed here. The first month after surgery, we do recommend the Bariatric Advantage Advanced Chewable Multivitamin, 1 in the morning with breakfast and 1 in the evening with dinner. The chewable is recommended to allow your anatomy to heal appropriately for the first month, as many patients have trouble swallowing different textures for a few weeks post-op. After 1 month, you can choose to switch to the Bariatric Advantage Ultra Multivitamin Capsule, or you can stay using the Bariatric Advantage Advanced Chewable Multivitamin. If taking the capsule, then you will need to take 3 capsules a day. We recommend spreading these out in divided doses with your meals such as breakfast, lunch, and dinner. You can also do 2 in the morning and 1 in the evening if preferred. If you'd like to continue taking the chewable multivitamin, stick to 2 capsules daily, such as 1 with breakfast and 1 with dinner. After 1 month, you will add in a calcium citrate with vitamin D supplement. The recommended doses are listed here on the handout. Bariatric Advantage does have a chewy version of this brand if you prefer to stick with the brand. You'd use 3 of these chewies in 1 day, separated throughout the day, or 4 in a day if you have the duodenal switch or SATI procedures. Try to keep your calcium supplement at least 2 hours separate from your multivitamin and any other high iron foods that you eat. Calcium and iron work against each other, meaning the body will struggle to get maximum benefit of either. If you choose to purchase over-the-counter calcium supplements, we do have a few general rules you'll want to follow. First, use calcium citrate for the best absorption in your gut. Second, get a calcium supplement with vitamin D already in it. These two help each other absorb, giving you maximum benefit from both. Third, check the dosage of the supplement you purchase. You'll want to be aiming for 1,200 to 1,800 milligrams of calcium intake in a day, 2,000 to 2,400 milligrams if having the DS or SATI procedure. You'll need to determine how many of your supplement you need to take daily in order to get you within this goal range. If you have the duodenal switch or SADI procedure, then you'll also add in the Bariatric Advantage High ADEK vitamin once per day. Typically, you'll begin taking this prior to surgery after your pre-op, but discuss with your provider for specific instructions on when to start. Another good supplement is omega-3 or fish oil. 1,000 to 3,000 milligrams a day is appropriate. If you desire to start this supplement, you can add it in 8 weeks after surgery or more. For women of childbearing age, it is of utmost importance to make sure you do not become pregnant for the first 18 to 24 months after surgery. Your body needs significant time to adjust to the new levels of energy and nutrition you need to keep you healthy first, before being able to provide energy sources to a growing fetus. We do not recommend taking additional biotin or hair, skin, and nail supplements. Too much biotin can cause false readings on important lab tests such as thyroid and other hormone levels, vitamin D levels, and troponin levels, which are cardiac enzymes that tell us if a person is having a heart attack when they go to the ER with chest pain. Your multivitamin does contain extra biotin, as it's designed for people who are dealing with malabsorption concerns, such as those who've had a bariatric surgery. The amount of biotin in your multivitamin is safe after your surgery, but do not use more. Please note, if you're noticing hair loss after surgery, this is a natural reaction to your body recalculating your energy intake and calories. Your body will focus on the priority areas first, meaning it will focus on vital organs. When hair is no longer a priority, it shifts into a non-growth phase, which is when you may see it shedding in large amounts. There is a peak time range for this to occur after surgery, usually about 5 to 9 months, after which your energy intake is deemed appropriate for keeping vital organs working, and thus shifts back to non-priority areas such as hair and nails. If you are doing any sort of your own choice of supplements, we strongly recommend against using any gummies or patches. These are mostly made with fillers. You'll not be getting the best bang for your buck. There are locations throughout the FM area that carry some of the Bariatric Advantage supplements, or you can pick up at any time during our clinic hours. You do also have the option of the Bariatric Advantage website, allowing you to set up an auto ship as well as receiving a discount by using our validation code FARGO. This is different than a coupon code, which you'll see at checkout. Ultimately, please do remember this regimen is lifelong after surgery, not just for the first few months. These vitamins are specifically made for patients who've had a weight loss surgery and are thus at risk of malnutrition. Our goal for you is to lose weight and remain healthy in the process. You may not absorb everything from just your healthy diet as you would have before surgery, so it's imperative that you supplement with quality vitamins. We do not want you to use non-steroidal anti-inflammatory drugs, also known as NSAIDs, or steroid medications after your surgery. These can put you at risk for complications such as pain, ulcers, bleeding, or perforation, which is a hole in the lining of your stomach or intestine. A human with a normal-sized stomach is already at risk of these complications if using these classes of medications chronically. You are at greater risk after your bariatric surgery due to the removal of much of the surface area of your gastric mucosa. We want to minimize the risk of these complications by avoiding NSAID and steroid medications unless approved by your weight loss team. Keep in mind, weight loss surgery itself puts you at high risk for developing ulcers, and we'd like you to be aware of the signs of this, which include abdominal pain, which may get worse with eating, nausea and/or vomiting, or heartburn. If you experience these symptoms, we ask that you let your weight loss surgery team know. These classes of medications will be listed as contraindications in your chart with the allergies. Note, they are not true allergies, meaning if they're necessary, they can be used in limited amounts, but they are best avoided altogether. We also provide you with a list of common NSAID medications to be aware of, like aspirin, ibuprofen, Advil, Motrin, naproxen, Aleve, and others listed on this handout. Please be aware that some NSAID medications could be in combination products, such as aspirin being in Excedrin or ibuprofen being in some cough and cold medications, so please read the ingredient labels of the product you're purchasing. We want you to be able to advocate for yourself with these medications, but we also want your provider to be aware of the risk posed to you in case you're unable to speak for yourself. So, if providers are able to utilize a different medication than these in a situation, they should. For example, using a pain medication other than Toradol would be preferred, such as Tramadol, if needed. However, if a provider is not able to utilize a different type of medication, say during a life-threatening breathing emergency where they need to use a steroid to save your life, they are not prevented from using these as needed, as they are not true allergies. We would simply want that provider then after the fact to mitigate any potential damage to your gastric lining if they had to use this medication, such as prescribing a PPI for some time afterwards. This handout provides examples of over-the-counter medications that are okay to use safely after weight loss surgery. It's not a complete list of all the medication you can use, but gives you an idea of medications that are available for common conditions like allergies, congestions, and cough and cold. For mild pain or headache, acetaminophen or Tylenol is the recommended over-the-counter medication after weight loss surgery. A reminder when using this medication, do not exceed 4,000 milligrams of acetaminophen in 24 hours. Constipation can be a real issue for some people after surgery, as you will have just had anesthesia, you're eating less, and you may be using opioid medications post-operatively. We typically don't expect a large bowel movement for at least 3 to 4 days after your surgery. This would be normal and not considered constipation, even if you're normally more regular than this prior to your weight loss surgery. Stool softeners such as Miralax or Colace are typically effective if used regularly for the first few days postoperatively and are available over the counter, safe to use right after surgery. Typically, Miralax is the first-line treatment recommended by your doctors and providers after surgery. After a few days, you can add in a laxative such as Senna, which is also available over the counter, to help move things along your colon, while still also taking a stool softener to make it easier to pass bowel movement. If these two medications don't work to produce a bowel movement within 5 to 6 days, contact your nurse to make them aware. They can then talk you through the next steps, which may include utilizing a suppository or enema at home. If you go longer than 7 days post-op without a bowel movement, we may determine to have imaging completed to ensure there are no bowel obstructions or other concerns occurring. Fiber products can also help with constipation down the line, but we would like you to hold off on taking these until 3 months after surgery. These are things like Metamucil or Bariatric. Please ensure you are hydrating well and moving often to move your bowels along. This is the getting ready for surgery information you'll receive at your preoperative appointment, likely attached to an after-visit summary. Please review the after-visit summary or AVS given at your appointment or on my chart closely and keep track of this information so you can review as you need. This information reviews steps that can be taken to enhance or improve recovery after surgery. These guidelines help to improve breathing, blood flow, return of bowel function, pain, and overall well-being after surgery. Before surgery, we recommend being active with some form of activity such as walking 30 minutes a day for 5 days or more before surgery if you're able to. This will help you get active again as soon as possible after surgery, which will be key to your pain control and overall healing and weight loss. We do recommend washing your hands often and staying away from others who may be ill prior to your surgery so you can stay healthy. You may be given a pre-surgical carbohydrate drink to bring home for the day of surgery. This drink is recommended for you to have about 2 to 3 hours or so prior to surgery. A nurse will call you from the hospital the day before surgery with more instructions, and they will tell you what time to drink this. It does taste better cold, so put it in the fridge. Not all patients are appropriate to have this drink, such as diabetics or previous weight loss surgery patients. Your clinic nurse will provide you with the drink if it's appropriate for you. Soon after surgery, we recommend moving your legs and feet to get the blood flowing and prevent blood clots from forming. This can be done by getting up and walking around or simply wiggling your legs and feet while sitting or lying down. Staff will help you get up and walking as soon as you can safely do so after your anesthesia. If you have any questions or concerns before or after surgery, you can contact the clinic at the phone number listed below. We are in clinic Monday through Friday from 8 a.m. to 5 p.m. If you have questions or concerns after hours or on the weekends, the My Sanford nurse number is also available and they can assist with troubleshooting your concerns. We'd like you to have someone to stay with you for at least the first 24 hours after going home to monitor for significant signs of infections such as personality changes, acute confusion, or acute lethargy. If these are noticed, that support person would want to get you directly to the ER for assessment. For lesser concerns, such as questions about your incisions, low-grade fevers, or pain management questions, please call the clinic first, and we can troubleshoot these with you and aim to keep you comfortable and healing at home rather than needing an ER visit, which can be difficult for you. The AVS will also provide information on the date of your surgery, type of surgery you'll be having, and the surgeon performing the procedure. Your surgery will take place at the Sanford Medical Center, Fargo, otherwise known as the New Hospital in Fargo, which is located at 5225 23rd Avenue South in Fargo. You will go in through the main patient and visitor entrance on the south side of the building and up to the 3rd floor to check in at the Admissions Recovery Unit, or ARU. As stated previously, a nurse from that unit will give you a call the day prior to surgery, typically after 12 p.m., to review further instructions, including what time you need to arrive at the hospital for your surgery, when to stop eating and drinking prior to surgery, and any medication instructions for that day, as well as what time to drink your pre-surgical drink if you have one. Don't panic if you haven't received a call by 5 p.m., as they are often making calls up till 7 p.m. for the next day. You do not need to bring any of your medications or vitamins with you to the hospital. All medications you'll need will be provided by the hospital pharmacy. A reminder, though, that we do want you to bring your CPAP machine with you if you have one. Many patients utilize the CPAP after anesthesia, and yours has your own settings already in place. In addition, the use of the hospital CPAP is significantly more expensive. At your preoperative appointment, you will be given instructions on medications you may need to hold prior to surgery. Please refer back to your after-visit summary for that visit for these instructions. Please note, it is important to review the medications and stop dates, as surgery may have to be postponed if you do not stop medications on the date you're expected to do so. You will have at least one overnight stay in the hospital, and we want someone available to drive you home when you discharge from the hospital. If your support person prefers, and if you agree, you are allowed one visitor to stay with you in the hospital room, as there is a couch that pulls out into a bed in your room. They must be at least 18 years old. Also listed are some good things to do to help prepare your body for surgery and better recovery, including following your shake diet, getting some exercise, and getting adequate rest and sleep before surgery. We do not want you to have any energy drinks or alcohol within 24 hours of surgery. We want you to shower the night before and the day of surgery with Hibiclen solution or an antibacterial soap. Start this process by washing your hair and face with your normal products. Using a clean washcloth or loofah sponge, wash with the Hibiclen solution from your neck down to your feet, or the cleanest part of your body to the dirtiest part of your body, focusing on the area of the incisions for approximately 1 to 3 minutes. Utilize a clean towel afterwards and clean clothes to go to bed. Do not put anything on your skin after the showers, such as deodorant, lotions, powders, colognes or perfumes, or makeup. This includes anything that may be prescription strength. You'll receive some of the Hibiclen solution at your preoperative appointment, but if you lose this solution, you can also purchase Dial antibacterial liquid hand soap at any drugstore to use for this purpose. We want you to remove any jewelry for the day of surgery. You may use plastic spacers if needed. If a cautery device or imaging are used during your procedure, anything metal on you could become an issue or a safety risk. We do want you to have at least one fingernail free from polish or coverings to monitor your oxygen during the procedure. Stop eating and drinking at the time directed with your phone call the day before. No hard candy or gum after this time either, as extra saliva may wash into your stomach and become a problem. You may brush your teeth prior to leaving for the hospital. We recommend leaving all valuables at home so that you don't risk them being lost or broken at the hospital. However, you may pack some belongings to bring with since you'll have an overnight stay. We recommend wearing clean, loose, comfortable clothing to the hospital. If you're a woman and get your period the day of your procedure, we would like you to wear a pad instead of a tampon. The AVS also discusses what to expect when you get to the hospital the day of surgery. If you've had an outpatient surgery previously, it may be very similar. If you have a support person with you as you're checking in, they may come back to the preoperative area with you during this time. They may also provide a phone number for text updates during your procedure, so they can leave the waiting room if needed during your procedure. You are first brought back for the admission process where the nurse will check you in. You'll perform another scrub of your skin, then be changed into a surgical gown and prepped for surgery, such as placing an IV. You will be asked to remove any contacts or dentures at this time. You'll meet with your surgeon and the anesthesiologist prior to surgery, and all consent forms will be confirmed. If any labs are missing, those will be drawn at this time as well. Females who have not reached menopause or are not surgically sterile will be asked to provide a urine pregnancy test at this time. You will be brought back to the operating room where you will be given a strong antibiotic to help fight off post-op infection, then connected to equipment and given medication to put you to sleep. This process is very quick. Once the surgery is complete, you will be brought to the recovery room to be monitored as you wake up from the anesthesia. The nurse here will ensure your vitals are stable, as well as assist you with any immediate post-op pain or nausea. Once you are stable, you'll be transferred up to the hospital unit 8AB, located on the 8th floor. The staff here are experts at caring for our post-bariatric surgical patients and preparing for them to recover at home. This handout discusses what to expect when you get to the hospital floor. As stated, after recovery, you'll be transferred up to the 8th floor, Unit 8AB, where they specialize in the post-op care for weight loss surgery patients. The nursing staff here will be checking your vital signs often after surgery, so do expect, if you're sleeping or napping, you may be woken up for this. This step allows staff to quickly determine if you're having any post-op complications that need intervention, such as infection or leaks, prior to you even feeling a concern. You will be started on a bariatric clear liquid diet at this time and progressed from there. You are only allowed to have food brought to you on a tray from staff, no other food or drink from outside sources, but you're welcome to have as much water or ice chips as you'd like. We do ask that you at least attempt some of this clear liquid diet to determine if you tolerate it, which would allow you to progress the following day to a full liquid diet. If you do not finish the items on this clear liquid diet, this is okay, as we understand that you may not have much appetite as you're coming out of anesthesia. Nursing staff will get you up and walking as soon as the anesthesia wears off enough to be safe, which can help to prevent blood clots and help with pain. If you feel stable at this time, you may be allowed to walk in the hallways on your own. Just take the IV pole with you. If you do not feel stable, we still want you to walk as frequently as possible, but always make sure you have staff helping you in this case to reduce your fall risk. You'll want to walk laps around the unit floor at least 3 times during your stay, not just from the bed to the bathroom and back. If you use a sleeping machine, such as a CPAP, you will need to use this during your stay. Staff can help you set this up. They do have distilled water available if you use this for your machine, so you don't need to bring this with in your luggage. Regarding pain and nausea, nursing staff will have scheduled times to be bringing you your medication for these. Since everyone's post-op pain and nausea is different, you'll need to let staff know if you are feeling this is not adequate, as they can then provide you with different medications outside of these scheduled times. They cannot and won't know to bring you these medications extra if you don't let them know that you need it. Some of your post-op pain may be due to medical gas that's used during your surgery. This pain is basically a gas bubble, often felt in one or both shoulders, but oftentimes also in your chest, back, or epigastrically. Unfortunately, most medications won't work to help ease this gas pain, so even if you took extra pain medication, you may still feel the pain, which can last up to a few days after surgery. However, walking, repositioning, and heat and ice may help with this gas pain specifically, as well as the regular post-op pain that you're feeling. Make sure to keep sipping water throughout the night. While your IV will help you keep well hydrated in the hospital, your provider will want to know that you can tolerate drinking water in order to stay hydrated at home. By the next morning, nursing staff needs to ensure you've met a few requirements. 1, they'll ensure your vitals are stable and in expected healthy ranges. 2, they'll manage your post-op pain and nausea. This means even if you did need some of the extra medication, they need to make sure that these worked so that providers know what to send you home with prior to leaving the hospital. 3, walking a minimum of 3 times around the unit, and 4, voiding. The next morning, you will meet with the doctors and providers, and if you're doing well, you'll be able to be discharged home. If discharge orders are placed, a dietitian will meet with you prior to you leaving to ensure you know which post-op diet you'll be on at home and answer any final questions that you may have forgotten since your pre-op class. Most likely, a pharmacist will also bring you any medications that you'll need to take at home in order to avoid you having to stand in line at the pharmacy. The unit aims for a discharge time around 10 a.m., so please have someone available at that time to bring you home. Please keep all material given to you at your preoperative exam and nutrition appointments, along with discharge papers from the hospital, so they are easily accessible to refer back to during your recovery. Lastly, Sanford is taking part in a national quality improvement initiative regarding opioid use called B-Stop-D, or bariatric surgery targeting opioid prescriptions on discharge. The goal of this initiative is to determine if opioids are being overprescribed at the time of discharge, and thus preventing this overprescription, which creates more opioids being out in the public. Please note, your pain control is very important to us. Please familiarize yourself with this booklet, which will be provided to you in your preoperative folder. While opioids may be used for a few days after any surgical procedures, It's been determined that not all patients even need to use them. Some patients don't feel enough pain to use any pain medications, and others are able to use non-opioid pain management efforts successfully. The goal of this initiative is to make you, the patient, more aware of these non-opioid pain management options prior to surgery so that you can effectively manage your pain at home post-operatively. If you are recommended to take Tylenol, gabapentin or Neurontin, or any muscle relaxers, please make sure to use these around the clock if indicated in your discharge papers. These will help to keep your pain at a tolerable level, which is much easier on you than trying to get intense pain to come back down to a tolerable level. You can also make sure to try non-medication comfort measures such as walking, heat and ice, distraction, or at times even topical medications such as Biofreeze, Tiger Balm, or lidocaine patches. If you're struggling with pain control efforts, please reach out to your clinic. Be prepared to describe your pain using a 1 to 10 scale of intensity, as well as how the pain feels, such as stabbing, aching, throbbing, etc. Though the clinic may often not prescribe more opioids if you did go home with some, we still want to make sure we assist you with your pain. If you're having intense pain for more than a week after surgery, we may want to do some imaging or other testing to determine if there's a reason for this. Pain should be decreasing a little bit each day if you follow your restrictions and recommendations appropriately. We thank you for taking the time to review this information. Whether you review this before or after your procedure, the information included will help you on a road to speedy recovery. You should already have some dates scheduled for your post-op appointments with your surgery team. Please do not hesitate to reach out to your team at 701-234-4111 if you have any other questions or concerns in the meantime. Good luck!